Hey everyone, welcome back to our channel. My name's Derek Parker, the owner of SoftWave Therapy, and today we're going to be tackling some of the frequently asked questions about SoftWave Therapy. So if you've been curious about our treatment, how it works, some of its benefits, what to expect, stick around as we dive into the details. Let's get started. So first things first, what is SoftWave Therapy? I think simply put, it's a non-invasive treatment that uses acoustic sound waves to reduce pain and promote healing. Unlike other shockwave therapies, SoftWave utilizes specific acoustic waves. They're called electrohydraulic shockwaves with a parabolic reflector that are gentler and more effective compared to other shockwave therapies. Now, how does it work? Now, before I dive into this question, one thing we're damaging the tissue. So SoftWave works in two ways, short-term and long-term. Short-term, the goal of SoftWave is to decrease inflammation and pain. Long-term is to regenerate tissue, thus improving mobility and function. So how it decreases inflammation is SoftWave rapidly compresses and expands your cell membrane, and it literally is shoving out cellular waste, increasing cellular mobility. And so it is able to knock out cellular waste, thus decreasing pain. The long-term effect of what SoftWave is doing is every time it's compressing and expanding your cells, it secretes messenger cells that tells your brain there's an injury going on called as exosomes. And so your body secretes two things that go on. First, it starts up angiogenesis. It starts creating new blood vessels, and then it starts sending stem cells, progenitor cells, and other growth factors that help regenerate tissue. So if someone were to ask me, how does SoftWave work? Simply put, it's three things. It decreases inflammation, it creates new blood vessels, and it regenerates tissue. That's how SoftWave helps decrease pain and promote healing. So how long does SoftWave take to do its magic? Well, there's a two-part answer to that. To decrease pain and inflammation immediately, it takes anywhere from 30 seconds, and it will last up to about 48 hours usually. So people usually say right after treatment, I feel pretty loose, and that usually lasts about 48 hours. But people don't do SoftWave just to decrease pain and inflammation for a short time. They do it to do those things for a long time. And so that is why we do about 6 to 8 treatments to regenerate tissue so that it can last a lifetime. To regenerate tissue, the long-term effect, it takes about 8 to 12 weeks to regenerate tissue. So short-term, it can be immediately after treatment and last up to 48 hours. And to experience the long-term benefit of SoftWave, it takes about 8 to 12 weeks and can last up to a lifetime, as long as you don't hurt yourself again through your movement or you get hit by a bus. SoftWave is extremely versatile in that it can be used to treat a wide range of conditions. And we usually break it down for our patients in explaining this. SoftWave treats three main areas. We treat orthopedic injuries, urological disorders, and wounds/burns. So with orthopedic injuries, that's ranging anywhere from arthritis, tendonitis, nerve degenerations, muscle strains, muscle tears, strains and sprains. If someone came in, we treat acute injuries, we treat chronic injuries. If someone's back has been killing them for 30 seconds all the way up to 10 years. And SoftWave is very effective in getting people out of pain and back to movement they love. With urological disorders, we usually treat erectile dysfunction or pelvic floor pain in women after birth. And then SoftWave treats wounds or burns. We treat burns, we treat diabetic ulcers or just open wounds, non-healing wounds. We treat a lot of people with neuropathy that have wounds that aren't healing. So those are just some things that SoftWave can treat. In Europe, SoftWave is even used in some dental cases. It helps lock in teeth that keep falling out. It is very helpful for TMJ disorders. SoftWave has even seen really good success treating Alzheimer's. In Austria, I believe they started using it in open heart surgery. Fun fact, in Austria, orthopedic surgeons can get sued if they don't do SoftWave before treating them before surgery. So hopeful for us Americans to understand that technology like this, and specifically this, is used worldwide. It's been used in Germany for over 20 years. It started in 2004 and has recently come over to America, FDA cleared in 2020. So SoftWave treats many things. It seems like it might be too good to be true, but it's not. We're having tremendous success. Anywhere from orthopedic injuries, 85 to 90% success rates, meaning people are walking out that had pain and now have none. 85 to 90% of our patients are walking away without pain. It's 99% effective for all my ED patients. We worked on 80-year-old men that are walking out saying, I feel like I'm 17 again, and their wives are blowing me kisses, writing me thank you notes. And same thing for wounds. People that have said, yeah, this hasn't healed in 2 years. My wound care specialist and nurse is cleaning it all the time, but it's not healing. And SoftWave is closing that wound in 12 weeks, which is crazy. So those are some of the things SoftWave treats. Every clinic is different that does SoftWave, but what you can expect at SoftWave Bimolo Therapy with me is at your first visit, you always get a mobility assessment, a consultation, and a treatment. So you're actually going to get shocked that day. The mobility assessment is we're trying to see, do you have range of motion, and do you have control throughout that range of motion? What points are hurting? We do different tests to kind of see, okay, helps me understand where your pain might be. We do a consultation. We look at your past history. We look at like your sleep, your water intake, how often do you move, your diet, kind of get a good history of where you've been, where you are, and we talk about your goals. Where do you want to be? So we often talk about MOLO, movement you love. We believe movement you love is therapy. It's called MOLO therapy. And the end goal, the reason we do SoftWave is to get you back to MOLO, movement you love. We don't do it just so we can say, yeah, I regenerated tissue. No, I want you to get back to playing pickleball, playing with your grandkids, being able to crawl on the floor while your kid jumps on your back. We're trying to get you back to movement you love. And so that's our consultation. And then the treatment is usually something like this. So I usually drop it down to about a 1.5 frequency, and we go pretty slow. This is about what it sounds like. So pretty slow. And what I would do is I'd put ultrasound gel on, like say we're working on your knee, we'd put it on your knee, and then we would go that slow around your knee. I'd work on all relative areas. I work upstream and downstream. If you say you have knee pain, you might have issues in your hip and your ankle, and they might be meeting at the knee. And so I would work on your knee, I'd probably work on your hip, your IT band, I'd work on your shin, I'd work on your ankle. I'm just trying to find all the spots that hurt. So SoftWave only hurts if it's damaged tissue. Damaged tissue could be poor circulation, arthritis, tendonitis, nerve degeneration, muscle strains, or muscle tears. It's any tissue that's not healthy. And you only feel a little bit of pain when it's damaged tissue. And so I would basically be scanning, trying to find all the spots that hurt the most. And then we do that for about 100 pulses. Takes about a minute or two. And then I would speed it up once I have tracked all your spots that hurt. And then this would be the speed that it would go at. Pretty fast. And so now instead of scanning, I'm going to sit on the area that hurts and just go for it. And we'll hit each one. And then we usually will go through your movement assessment again after I hit all your hot spots, test and retest. And most of the time people are like, whoa, my pain's kind of gone, or it's significantly decreased. If you still have the same amount of pain, that's when I start checking other areas. But you're not walking out of here until I can decrease your pain, which is a comforting thing for most patients, because usually people want to walk in expecting to walk out feeling a little different. So that's what you can expect at your first treatment. Now, what should you expect at follow-up treatments? That's a pretty easy question. Let me first say, at your initial evaluation, we usually give our patients about an hour, just so we can talk, we can treat, we can answer any and all questions, and just give you time to process. But all follow-up treatments are anywhere from 15 to 20 minutes. You come in, we shock you. The treatment itself is relatively short. It's anywhere from like 5 to 10 minutes. And then afterwards, we usually work on preventing injuries. And so we start implementing your MOLO movements or exercises that help prevent injuries. So follow-up treatments are anywhere from 15 to 20 minutes, but your initial evaluation, you always have an hour. You don't have to use up the whole hour, but we give you an hour so we can answer any and all of your questions. So what are the side effects? Thankfully, SoftWave has no side effects, no major side effects. The only side effect is either you're going to feel extremely loose, or sometimes, and we've minimized this over the years, Some patients might walk away feeling a little more tender, and so the reason that is SoftWave doesn't damage tissue, but it will send so much current through your nervous system that your pain receptors are just very sensitive. And so we don't damage tissue, but you will walk away more sensitive. That's why we then start decreasing the energy level, so we don't need to send so much current through your nervous system. But these are the contraindications that we will not work on. We do not work on anyone if they have a pacemaker. We don't work over their heart. They might be getting rid of that though, because they're using SoftWave on pacemakers in Austria. That's for another time to talk about. We do not work on anyone with active cancer or tumors, because SoftWave Therapy, theoretically, it's regenerating tissues, and we do not want to replicate any cancer cells. We always get parental consent for anyone that is 16 or under, because theoretically, again, SoftWave could increase the ossification of growth plates. We have seen none of that. We work on kids that are 16 and under. We turn it real low, and we're getting kids out of pain, mostly all athletes. Another thing we do not work on is anyone that has had a steroid injection within the past 3 weeks. It actually will increase inflammation, make it a little more painful, and not effective, because steroid injections numb pain receptors. And with SoftWave, a phrase we often use is you have to feel it to heal it. So if you can't feel it, then you can't heal it. So those are some of our most common contraindications that we don't work on. And then our last one, though, is that we do not work on any pregnant women. So theoretically, the shockwave could literally shear apart an embryo, so we don't even want to play with that. So that's the last one that just came to my mind. But we don't work on any pregnant women. We can work on knees and ankles, but we will not work on your back or on your stomach, obviously. So there you go. So how do you book your first appointment? That's pretty simple. You can either go to our website at softwavebymolotherapy.com, click the SoftWave tab or Book Now tab, and schedule your SoftWave evaluation. There is a follow-up tab. If you are following up, you can click on that, but if you've never tried SoftWave, do the SoftWave Therapy evaluation, or you could just call us at 573-200-6865, and we'll just get you scheduled. So hopefully you found this video helpful. If anything of the conditions I listed applies to you, I think SoftWave Therapy is worth a shot. It's non-invasive, requires no downtime, no drugs required, and you get back to movement you love. Our job is to empower you. You only are going to be with us if you do commit to SoftWave for like 6 to 8 weeks. I'm not trying to lock you in for life, and we want to provide education, teaching you how to fish, so you don't have to come to me all the time for fish. I don't want you to ever come back after SoftWave. I want to regenerate the tissue, prevent it with exercises, and equip you to go on your way and enjoy movement you love for the rest of your life. So hopefully you found this video helpful. My name's Derek, the owner of SoftWave by Molotherapy, here to help you heal yourself.